Your calls at 303 Martino and check in with the Purple People Meter. All right, you see LASIK surgeon Dr. John Dishler here a lot on my show. He's one of the pioneers of LASIK surgery in Colorado and around the country. And today we have some other guests with us from his practice. Well, there's one from his practice. One used to be with his practice, now has her own practice, but she refers to Dr. Dishler. Dr. Kim Brownfield is with us. And Dr. Brownfield, you're one of the first people that people talk to when they come to Dishler, and you screen them and talk to them?
Yeah.
Do you do some of the exams?
I do. So when patients come in for their initial consultation, we do a whole battery of testing.
Yeah.
Some of it is very similar.
Extensive.
Yeah. Some of it is similar to what they get done at a normal eye exam, and then others is very specific for the actual surgery itself.
And we should mention that's all complimentary.
It is.
So you get a really good screening.
Yeah, a normal consultation takes about an hour, and it really is a team effort, all from the technicians that start, and then I sit down and meet with the patients, and we really talk about their particular visual demands and how LASIK may play into that and decide if it's something that's right for them.
So you work with Dr. Dishler, and then Dr.
Yes.
Cindy Beeks. Mm-hmm. You used to work with Dr. Dishler.
I did. I started in the early days, and we were developing LASIK, and then we were also developing our co-care program, where we involve the patient's individual eye doctor with the LASIK procedure.
Right. And so you went out on in your own practice as an optometrist.
Right.
And so as an optometrist, how do optometrists, because he has a number of them around the state and even in other areas that refer to him, how does that work? If people want to come to their own optometrist or to you, how does that work?
Well, patients come to us, and we talk to them about what kind of candidate they are, and then we try to pick the very best surgeon to send our patients to, and I certainly think that's Dr. Dishler. And we do a lot of the pre-op care at our office.
Okay.
But we like to send them to the center to meet Dr. Dishler and Kim and the entire staff, and they do some additional testing. But then we can take care of them after surgery at our practice. It's a real team effort, and it works well for the patient.
Sure, especially if they're used to their own doctor and they have a relationship there. They don't have to leave them. They can go to Dr. John Dishler's Surgical Center, have it done, come back to you for aftercare, and of course, if there's any problem, you have a direct line to Dr. John Dishler.
Absolutely. We work as a team, and I always tell my patients it is a team effort, and we can see them at our practice, but if we need anything from Dr. Dishler and his staff, they're available to them.
And what I really like is how many optometrists, how many eye doctors, so to speak, refer to him. They must really have a lot of confidence in him.
Oh, they do.
And I imagine you have other eye surgeons trying to get your referrals.
Absolutely. When I left Dr. Dishler's practice, actually I had a number that wanted my patient base, but I think John is the best, and that's where they go.
Really, and that's a fact when it comes to technology, the surgical center, and I want to get back to the pre-screening because it is so important. So, Dr. Brownfield, let's talk about how long you've been there.
Yeah, so I've been there for about 9 years.
And you see all patients
Yes.
before and after.
Yes.
What are patients, because we have many potential patients now listening, what is their major concern? Why don't we just address those?
Well, safety is a big thing.
Right.
Patients are always concerned about that. There's a certain amount of fear that happens as well of the procedure itself.
Right, a little nervous.
Yeah, there's lots of people that aren't real crazy about going to the eye doctor or wearing contact lenses, but they really want to get away from glasses, and they're nervous about the procedure itself.
Yeah, they think they have to stay dead still.
Yes.
And the tracking lasers now are quite liberal.
Yes,
as
they
far
are.
as moving around.
And medications are helpful as well.
Yes, you can take a tranquilizer.
Yes, so we give them all of that, and really it's about the experience. You know, we have some nurses as well that have been with us for well over 20 years, and really the goal on surgery day especially is to make sure that patients have a really great experience and that they feel comfortable with everything.
Okay, so how does the co-management work specifically now? If people have their own eye doctor,
Yes.
if they go to Dr. Cindy Beeks, do you get a call from her first and then the patient shows up? How does it work?
Yep, it depends on what the patient's
Do you have
most
to do the
comfortable
same
with.
exact
So-
screening when they come in?
So if a patient has their own doctor, and say they do live in the Boulder County,
Right.
and they don't want to come all the way down to see us
Right.
in Denver, they can contact Dr. Beeks, and she does initial screenings and consultations complimentary as well.
So she pretty much, or you pretty much know if they're a candidate?
Right. Right. They come to see us, we take a look, and probably oftentimes it's a patient that we've had for years, so we know them very well. And then we can talk to Dr. Dishler if we have any concerns. We have a good communication line that we go back and forth on.
And many people have gone to Dr. Dishler that have been told they're not candidates.
Yes.
How does that happen, and why does that happen?
Yeah, so some patients are not appropriate based on measurements of their cornea that is just not safe for them. Sometimes if patients have severe medical conditions that may affect the health of their eyes, it's not a good option. And we certainly would go into all that at their initial consultation. And often then we end up sending them back to doctors like Dr. Beeks.
But in some cases, some were told they were not candidates and ended up getting it through your clinic where other clinics could not have done it.
Yeah, and even the technology has changed over the years where some patients that used to not be candidates are better candidates today as the ranges of prescriptions that we can treat are much wider than it was.
So you're getting a wider range of what the laser can do?
Yes. So the lasers from the time that Dr. Beeks was first doing LASIK 10 years ago are much different in the quality of the vision and the optics. So patients that often weren't candidates or may have had halos at night now may come in and won't have that with surgery today.
And we should mention Dr. Dischler has been doing this for so long. He has his own surgical facility. It's an actual day surgical facility, right?
It is. It's an ambulatory surgery center. So we're staffed with nurses,
its own power supply, its own air supply.
Absolutely, everything. Backup generators for everything is a big concern that patients have. I wonder if something happens in the facility that day.
I've never thought of that.
So,
but
yeah, so the laser would run uninterrupted during a procedure in case of any power surge or anything like that.
And so with the advancement in technology, he also is involved in clinical trials. You guys are doing implants even now.
We are, and we were just talking to some of the staff here about it as well for a change in near vision for people that have had great distance vision their whole life, but just now we're starting to notice the changes up close. Sometimes we have procedures for them as well.
So for the latest in technology and advancement of care, also personalized care, customized care, the lowest guaranteed price for the same, if you compare apples with apples, that's what's really important. By the way, they also have 24 months financing with approved credit, and that's 0% financing. So let's give the number out, okay? Dischler LASIK, 793-3000, lowest guaranteed price there, 303-793-3000, online at Dischler.com, Dischler.com. If you go to Martino